Good afternoon, everybody. My name is Dr. Mike Varshavski, but most people, because of my social media presence, know me simply as Dr. Mike. I have a passion for talking about immunizations, primary care, debunking misinformation, which is on the WHO's list of biggest problems we need to tackle in the healthcare landscape. And I mention immunizations because it's one of the world's most successful healthcare interventions. But because of the COVID-19 pandemic, we had major disruptions to both routine childhood care, including immunizations, but also to basic healthcare needs. This is happening worldwide, and developing nations are suffering most. 1 in 5 children globally still do not have access to essential immunizations, and 50% of the world's population lacks access to basic health services. And I think with last week being World Immunization Week, today's discussion is extremely timely. I'm blessed to be on stage with 2 amazing individuals who are spearheading the world into a direction of health, of equity, and access to healthcare. So first question, I would like to ask Dr. Nishtar. You assumed the role as new CEO of GAVI, the Vaccine Alliance, just 6 weeks ago, and you're the first woman and the first individual from the Global South to lead the organization in its 24-year history. Round of applause. With your distinct perspective, how do you plan to attack this need for increasing access to basic healthcare needs?
Well, good afternoon, everybody, and let me begin by saying how deeply privileged I feel to be in a position to be able to touch the lives of people who are in a disadvantaged position. I've had that privilege in my country role as a Minister of Social Protection, and now I'm greatly humbled to be playing a small part at the global scale. So GAVI, as you know, is a very efficient, well-oiled, impactful machine that delivers results. Since its inception, it's delivered 1 billion doses of, it's immunized 1 billion children, it's halved child mortality, and it saved 17 million lives, and it's done at a very low operational cost with sustainability woven into its DNA, with empowering countries and at the cutting edge of innovation. As we stand today, and as an incoming CEO, because that's what your question was, I see that we have a wide landscape of vaccines available today. We have no shortage of supply. And the world has never had so many vaccines in its portfolio with the ability to save lives and reduce suffering. I think the challenge is in delivering them. In the jargon of GAVI, we refer to zero-dose children. There are millions of zero-dose children who have never received any vaccination all across the world in different pockets. There is also the residual work after COVID-19, because the world was so focused, understandably, on COVID-19 that routine vaccination kind of took a backstage. And there's a need to further that work. And I've been to the African continent just 2 weeks ago, and I saw firsthand the challenges that exist in delivery. So part of what I will bring, in humility, part of what I'll attempt to bring to the table is to draw on my prior experience as a Minister of Social Protection, where I delivered welfare through end-to-end digital systems in a country with a population of 250 million and reached out to 15 million families with an end-to-end digital solution. And I think it is that efficiency of delivery that I will try to strive towards. I will try to draw on cutting-edge new innovations such as AI, which have the ability to really jumpstart processes which can be very transformative in making things more efficient and effective. And I will try to draw on new partnerships on the ground, because again, reflecting on my trip the continent, to the African continent. Countries are clearly signaling to us that they need coherence as far as the role of international partners are concerned. So a focus on digitization, a focus on new technologies, better leveraging partnerships, and of course I couldn't, very inspired by the previous panel, women have to be at the heart of it, especially at the country level.
Absolutely, cheers to that. I applaud you on the mission of going from 14 million children to zero dose children, because that's an ideal goal for all of humanity. Andrew, your app, Mobi Clinic, has done amazing work to support the immunization effort. In fact, in just 2 hours, you're going to be recognized as a 2024 Global Citizen Prize recipient. Big round of applause. Now, what Mobi Clinic does is it connects community health workers with nearby doctors and clinics to expand healthcare access in places like Uganda, where you're from.
Yes.
How did you realize that a tool like that is important, and how did you implement it?
All right. First of all, I would like to thank Global Citizen for this platform. I'm very passionate about health equity, and I perceive the right to health to be the same as the right to life. The two are intertwined. So I witnessed this in the communities where I grew up. I come from Buyikwe, which is a rural area in Uganda, almost 70 kilometers away from the capital city. And while growing up there, I could see the disparities in access to care between the townships and the rural areas. And much of Africa, 80% of people live in rural areas. And so it's very prudent that we unlock access to care for them. So when I also started to traverse the sub-Saharan African countries in 2018 while doing some volunteering work with the African Union, I saw that this was a very pronounced problem, a huge problem. And I then got to start to investigate what are the underlying causes. And my team got to find two main issues. One, we have very few medics in Africa. In Uganda, where I come from, there is one doctor for every 25,000 people, far below what the World Health Organization recommends, that one doctor for at least 1,000 people. Then when you move to the second bit, the issue of distance, there are very few hospitals in these rural areas. And so we said, what can we do to circumvent these challenges that are bringing about lack of care for our people? So at Mobi Clinic, we said, look, let's do two things. Let's stop whining about the problem and what we don't have, and let's begin a new era of using what we have on table. We have the people. Let's decentralize basic healthcare knowledge to the communities, democratize it, include more willing community members to be skilled in terms of first-line care skills. And on top of that, let's use technology. Let's create a digital safety net. And how our app works is simple. Number one, it creates a digital safety net whereby these first-line caregivers that have been trained interface with doctors. So doctors in the comforts of their offices are able to remotely support the first-line caregivers. So that's one line. And then the second level is about integrated referral systems. We do not work in isolation. We onboard the existing facilities in the areas where we operate, private and public, and this helps in that a community health worker is able to know where to refer the patient. And also we have a future for critical emergency where a community health worker is able to call on ambulances in case of critical emergency. And most recently, we've included AI chatbot that has studied the patterns and supports in the interim when the doctor is not on the platform, but also we have included biometrics, facial biometrics, and the face of the patient is their password to their medical record. And this has supported continuity of care in communities. So that is how we implement, we've implemented it over the past 5 years, and to date we've managed to reach at least over 210,000 people, despite the small resources at our disposal. Thank you.
Amazing. It sounds like there are a few through lines to both of your missions of making use of technology, making use of collaboration, and not just collaboration between the public and private sector, but also collaboration with the individuals, with the people who actually require those healthcare needs. Dr. Nishtar, this is a big year for GAVI, and we'll be watching on June 20th when you launch your replenishment campaign, where you look to finance GAVI's efforts for the next 5 years. But that work doesn't stop before then. So you're announcing something pretty significant today. Would you share that with us?
Yes, very much in the tradition of the Global Citizens Campaign. I have the honor and privilege to announce today that GAVI will be reaching out in 20 countries of Africa with and vaccinating 100 million children with measles and rubella. So I'm very pleased to announce this.
Thank you, Dr. Nishtar and Andrew, for being here. Big round of applause for all their successes and the important work that they're doing, all that essential healthcare needs to those in need. And for those of you here in the room or watching worldwide, join us to demand that world leaders fund GAVI to protect children from deadly disease. Head to the Global Citizen app to sign that petition. Together, we can protect the future of millions. Thank you.